Hey guys, welcome. So today I'm going to show you how to look at a refinement, mid-treatment correction, and already in your head you should be knowing what's the next step and what you're going to tell the technician when you're doing aligner treatments. Just took a scan of this growing teen boy. As you can see, we still have some deep bite, and we had some delayed eruption, but we're getting the 4-5, 1-5 erupting, which is kind of nice. And on this side the eruption is a lot better, but we've got mild deep bite, mild overjet. We've got a class 2 canine on one side and a molar, and still a half unit class 2 here as well, with some midline asymmetry. So you can see the lower midline here shifted from the upper. So looking at this child now I can see the leveling of gingival height straight away. That strikes me. I can see the transverse is pretty good. So we've established the transverse is good. So let's look at vertical. So I can see a bit of leveling of the gingival heights as required. This is a 12-year-old teen. But we've got a lot of eruption already of the anterior teeth. So I'd obviously be extruding my canines, upper canines, and slightly intruding my 1-2 to 2-2. The smile allows for that. But also lower arch, there is a curve of space. All right, now we're going to look at sagittal correction. What am I thinking? Well, I think we're going to do some class 2 mechanics. We don't want to distalize the upper molar. There's still 7s to erupt, and we have a lot of space. We don't even need to do that. The overjet is mild. I think we're going to mostly use elastic simulation and hope there is also some growth to come that will correct the class 2s. So you can see I have a good idea in my mind what I'm going to do now. So let's look at how we're going to instruct the technician what to do. Right, so I'm doing spark aligners. This is a refinement set. So really I'm telling them exactly what I want. I'm saying, hey, I don't want expansion. I think there's enough adequate expansion. I'm telling them how much to intrude my 3-3-4-3, my lower canine to canine and upper lateral to lateral by a slight amount, because a lot of the deep bite correction is going to come from posterior extrusion. But I'm telling them to extrude all my lower premolars by quite a lot, 1.5 millimeter, but then the lower molars by only 1 millimeter, because now this is only for a draft simulation. Okay, I can't expect that just from these point notes the technician is going to get it right, but I'm going to get a simulation is kind of like what I want. And once I have a draft simulation, I will actually tweak it. I might use 3D tools. I might use instructions again to tell the technician what to do. And hopefully the aligners come, we bond new attachments, we get going, and we finish this case. Thank you.